Hi everyone, it's really good to speak to you today. I'm going to be talking about mental health. So I wanted to begin with a quote that really resonates with me. Michelle Obama addressed mental health by saying, "At the root of this dilemma is the way we view mental health in this country. Whether an illness affects your heart, your leg, or your brain, it's still an illness and there should be no distinction." Today I wanted to help destigmatize mental health issues by providing some insight as to how they form and the effect that they have. I think the first step in destigmatizing is having an open discussion about issues that you're facing. I'm choosing to share that part of my life with you today in order to start the discussion. Also, if a conversation about this topic will trigger unwanted thoughts or feeling, you may want to skip listening to this one. This is something you're no doubt familiar with. People share about mental health on social media. We have awareness days for mental illnesses, and we may even see people living on the street experiencing this. It is able to happen to anyone. All walks of life experience mental health issues. So first we'll go over how someone develops a disorder. Then I'll talk about how people are labeled. And then finally, we will go over why the stigma exists and what we can do about it. So mental health is imperative, and it's important to recognize the signs of mental illness as well as educating yourself on the issue. I hope this speech will provide some more insight into mental disorders and help you look at people with empathy instead of judgment. So how does someone acquire a mental illness? It's something called multifactorial inheritance. That means that some mental illnesses can be inherited from family, or it can be caused by trauma, or very often a combination of the two. So family members with a mental disorder put someone at increased risk for mental disorders. For example, on my mom's side of the family, schizophrenia is very common, and I am currently working with a psychiatrist to form a diagnosis for the issues I'm facing. Now, they don't think it's schizophrenia, but me having a family history of mental disorder has put me in increased risk of having a mental disorder. Another thing that can cause it is traumatic childhood, and this has long-term impacts. Complex trauma in childhood is unable to be dealt with by the brain of a small child. So it makes neurobiological changes that affect their cognitive and physical functioning. It can also be developed through hardships. So homelessness can cause mental illness, and it can also go the other way. In reference to an article I was reading, 2/3 of homeless people with mental illness had that mental illness prior to becoming homeless. So that means 66% of homeless people are probably homeless because of their mental disorder. Another disadvantage would be social or financial disadvantage in your life. This can lead to homelessness and mental disorders in most cases. Another thing is alcohol and drug use, which is linked to mental illness. Lots of people who have mental illnesses will self-medicate with some of these substances. So we talked about how someone can acquire a mental health issue. Now we move on to labeling people. How the label is applied to a person is through a diagnosis. That's the official way, but a lot of times people get treated differently because they behave differently or have a different mental issue that they're dealing with, and this is another label. So low income or homeless people are more likely to have an untreated psychological disorder. This is due to them simply not being able to afford care. Another thing that makes it difficult to get a diagnosis is that it takes a long time to get adjusted to the medications and see if they work. I have been going to the psychiatrist for 6 months now, and I have no diagnosis yet. Finally, we'll talk about how to end the stigma. So why is the existing stigma around mentally ill that they're crazy? The wrong terminology that people use in their everyday speech can be harmful to a person's self-image. For example, someone saying that they are OCD because they want something very clean or they like it organized a certain way. Instead, try using the words particular or neurotic. Another example is psycho. This one is particularly harmful because people experiencing psychosis have a total disconnection from reality, and to use that term lightly just kind of puts shame on people that do experience that. Instead of psycho, use maybe unusual or peculiar. So people who don't have access to healthcare will self-medicate as a way of coping. People are seen as a lowlife, even if they're just trying to escape the pain that they feel. This causes me to feel more empathy toward them, to just say, like, okay, wow, what an amount of pain they must be dealing with in order to medicate like this. So a lack of knowledge leads to a distorted view, and people with mental illnesses are just people. They deserve dignity and respect. Now that I've covered how someone becomes mentally ill, how they're labeled, and what you can do to end the stigma, I want to make sure that any questions you have are answered. So please comment on this video or privately message me if you need support. I have provided the links to the articles I read, as well as a link with common mental illness symptoms to be aware of and some statistics about that. So this may be a lot of information, but I hope you're able to take something away from today. First, we covered multifactorial inheritance, which means that mental disorders can come from a variety of factors, and we don't fully understand how they're developed yet. Then we talked about how people acquire a label and how it is actually expensive and tiring to get a diagnosis. And then when this is used against you after spending so long to get it, it can be very discouraging. Last, I provided some ways to think about how the mentally ill are struggling and ways to be supportive in their healing journey. A story that I just wanted to tell really quick is I was talking to a friend about a recent conversation that I had with my psychiatrist, and they immediately responded with, "I think I have that too, I'm so crazy," while laughing. It made me feel uncomfortable and invalidated, even though I knew my symptoms were real. So this is just one example of how a lack of empathy and understanding are prevalent to someone who is dealing with mental health problems. And it shows why it is so important to recognize the signs and speak up about mental health. So start the conversation with your friends and family. Thank you for taking the time to reflect on the difficulties of mental health disorders with me. I hope that this will remind you to be understanding, and thanks for listening.